Dr. Leisle, what about if a baby knocks out a tooth? What should be done?
Good question. Baby teeth that are knocked out in the front, if a tooth is loosened, let's go that first. If a child loosens a front tooth, within the first week, it should firm back up. Within the first 7, maybe 10 days, the tooth should firm back up, or it's going to have to be removed. Kids are real resilient, and the teeth will firm back up and won't be a problem. But if a tooth is knocked out of the mouth totally in the front, it stays out. You can try to put it back in, but they always come out. Now, that's different than, now when I'm saying that, when I'm talking about a child, I'm talking about baby teeth, the first 20 that you get when the front tooth is knocked out. And now on a permanent tooth that's knocked out in front, that's a whole different matter. Within the first half hour, you should get that tooth back into the mouth. You don't sit there scrubbing it at the sink, and you don't try to get into the dentist's office. I mean, you want to get in the dentist's office, obviously, to have your doctor look at it and take an x-ray and check it out. But the best thing to do if you see the tooth on the ground, it's better if it's in the house. If it's better on the floor than it would be out in the dirt, obviously. If it's in the dirt, best thing to do is rinse it off. Hold it by the crown of the tooth. Rinse it off, not scrub it off. Don't touch the root of the tooth. Just rinse it off, and then place it back into the mouth as soon as possible within that first half hour. You don't have to worry about going to the dentist and let him put it in just the right way, because he's going to do it the same way you're going to do it, except he would do it under anesthetic. But just get it back in the mouth. The child usually won't have a lot of discomfort when you put it back in right away, because the blood clot has not formed quite yet. The shock is still on the child. The child is still dealing with shock, and so they're not having discomfort because it's all just happened, and there's a lot of emotional, adrenaline's pumping through the child's mouth, through the body. So they're not going to notice the discomfort as much as they would an hour or two later. The longer you wait to put that tooth back in, the worse it is. And if it's more than an hour or two, it's a done deal. That tooth's going to be lost. Okay, it can be put back in, but the root will melt away, be resorbed, we call it, and then it's going to be lost. And eventually, an implant or something else will have to be done. So, basic thing: get it back in the mouth after you've rinsed it off. If it's on a clean area where it got knocked out, put it right back in. Take him to the dentist as soon as you can that day. The sooner the better. Get an x-ray of it, and it'll be fine. Usually they're going to do real well. You get in the dentist, if it's been, you might think, why should I go to the dentist if I put it back in? Well, because it needs to be fixed in position. It needs to be like a braces, hold the teeth in position as you're moving them. It needs to be, you might say, glued in position until it can be taken. The glue can be taken off a couple weeks, 6 weeks, 2 weeks later, depending on what the dentist thinks, so that it'll be firm and fixed in position.
Right. Afterwards, otherwise, normal eating and even just shaking your mouth might just, it just falls out again because it's not yet rooted and cemented back in, right? So you need to, for a little bit, hold it, put a little bandage on it to hold it on it, whichever way you guys then do that. Okay. Well, all right. Yeah. So basically, a knocked out tooth actually can regrow.
Well, what happens is the tooth isn't just in the bone. It's being held in position by about hundreds of thousands of little fibers, and they're holding that tooth in position. So you take trauma to it, that's what loosens it. It'll break a lot of those fibers. Obviously, if you had enough trauma and it's knocked out of the mouth, then it's going to take weeks. It's going to take some weeks for those fibers to reorient on that tooth surface to hold it. And as long as there's not a foreign body reaction because you didn't leave dirt on it or the doctor didn't leave stuff on there, then the tooth has real good chances within that short time, that first half hour, to be back in the mouth.
Wonderful.
Have good results.
Wonderful. Absolutely wonderful. So let's not worry about the kids getting involved in a little fist fight, because it doesn't matter. The tooth grows back anyway.
I wouldn't go that far.
Thank you very much, Dr. Leisle.
You're very welcome.